All right, so one more time, if we can give it up for our moderator and our panel. You know, in preparation for that, I got to tell you that the phone calls with the group were just as amazing and just as fun. So we really appreciate all the effort and everything that our panelists and moderator put into for today's event. Now, I have the great privilege and nearly impossible task to take only 1 minute to introduce our friend, Patrick Kennedy, former U.S. representative from Rhode Island, who's been a tireless advocate for mental health and substance use disorders. Among his many accomplishments that endear him to ONDCP and the recovery community is his leadership as author and lead sponsor of the Mental Health Parity and Addiction Equity Act of 2008, which set the tone to provide access to treatment for millions of Americans who were previously denied care. Here to give a summary reflection on today's program is our friend, former Congressman Patrick Kennedy.
Thank you, David. Thank you, David. And thank you, Michael Botticelli, for being someone in long-term recovery who's also leading the charge for this administration at ONDCP. To my colleagues, Tim Ryan and Paul Tonka, isn't it great you got members of Congress to stay through the whole program? and they're doing it every single day on the Hill. If you need a friend, go in their office, they'll help you network, and they need your help too, because we need to get Senator Whitehouse's and Senator Portman's legislation moving in the House of Representatives. And that's the legislation, as Sheldon talked about earlier, that's going to support supportive recovery, collegiate recovery, supportive community centers. They're going to help people who are in recovery stay in recovery. So thank you both for being here and being such great champions for us. And thank you, Pam Hyde, for helping to produce those evidence-based treatments through the work and research of SAMHSA that's going to tell us that recovery is possible because we have proven interventions, so we don't have to wonder whether recovery can work. We can show through the evidence, Pam, that recovery can work, prevention can work, and the only thing that's missing is our political will to make those programs available to more Americans. See my good friend Mary Bono. Now, we both worked on the parity law with my colleagues in Congress. 5 years ago now, we've got the first year of implementation of the Mental Health Parity and Addiction Equity Act. The challenge is making it a reality. Because just because it's written on paper doesn't mean it's written in reality. We as a community have to work on implementing the parity law, which means we have to get to know how insurance companies make medical utilization review decisions, medical necessity determinations. We need to understand how they might be imposing higher treatment limitations on those seeking recovery from addiction and mental illness when compared with our friends seeking recovery from diabetes, cancer, and cardiovascular disease. This is simple, my friends. In order to take our movement to the next level, we need to treat this like we would any other organ of the body with a chronic illness, and that's treat it and then continue to support the person who has a chronic illness so that they don't relapse. So I just want to say I look forward to working with the other agencies, SAMHSA, ONDCP, and HHS, which will oversee, the system of care that's going to be implemented for parity, and Department of Labor, which is going to be enforcing the Mental Health Parity and Addiction Equity Act with private employers, so that people who are trying to seek recovery in this country can be sure that their insurance plan not only follows the letter of the law, but follows the spirit of recovery that you heard here today which can be a reality for the millions of Americans who are suffering every single day needlessly only because of our neglect for this illness being treated like any other physical illness. So I am excited to be here, thrilled to be invited, and want to continue to work with you. We passed parity. Now we've got to work together to make sure parity is implemented so more people have the opportunity for recovery that you heard explained so well today. And I just want to count myself among them because I want to be among my fellows in recovery because I can't do this work. I couldn't be here before you today if I weren't taking it one day at a time and in recovery myself. And like that Hair Club for Men guy, remember? You know, he said, not only am I the Hair Club for Men, I'm also a client. So not only am I the sponsor parody, I'm also a consumer. Thank you very much.
I think we should have just let him close and just be done with the day. No, Patrick, you know, you're always an inspiration on a daily basis, but you inspire our office and the millions of people around this room. And you're right, we have lots more work to do, that we have a lot to be proud of. We've accomplished a lot, but we have a lot more work to do. Let me echo your thanks and praise to our colleagues and our partners in Congress. Congressman Tonko, he is actually the congressman in the district that I grew up in upstate New York. Waterford, New York, little town in upstate New York, and we couldn't have a better representative, not only in upstate New York, but in Congress to do this work. And Congressman Ryan, you know, you're right, this has been a hugely bipartisan issue. And we are so grateful for your leadership in the Addiction Treatment and Recovery Caucus, and we're really glad that you're with us today, and we look forward to your continued leadership and partnership. Today was really about living proof that recovery is possible, that it works, and that people recover. But we also heard today that we recover with the support of our families, our coworkers, our friends, and our communities. I want to thank our panel, Lori, Christina, Chris, Ruben, and Tim, for your incredible leadership. Despite how far we've come, I think you all know that it's still it still takes a tremendous amount of courage to tell your story. And to the women from N Street, thank you very much for setting the tone for today. You did a remarkable job. We're really fortunate to have you here today. To those of you who are watching online, especially the youth, we know folks from the Collegiate Recovery Program at the University of Texas and George Washington University are watching, and we have a message for you. We hope that you will be inspired by these stories today to be your own potential. 25 years from now, we expect you to be on this stage. Before we go, I just wanted to thank all of the distinguished guests who have joined us today for this really remarkable event. It has been amazing for us to have a launch a number of weeks ago with SAMHSA, and now to have another event at the White House. And again, I want to thank particularly the ONDCP staff who have really made this possible today. It's been an honor to represent this administration in this role, and I look forward to seeing all that we can accomplish in the coming months and years. Thank you very much.